Thank you so much, Nikki, and good afternoon, everyone, and a very warm welcome. My name is Dr. Viorica Kelban, and I'm your host for today's webinar organized by the MSA Trust. I am a neurologist looking after people with MSA at the MSA clinic at University College London Hospital. And I'm also leading the MSA research team at UCL. And it is wonderful to see such a strong response to today's session. We actually have a record number of attendees joining today, which really shows how important and how relevant today's topics are. And we are very much looking forward to promises to do extremely and valuable talks. And before we begin, just a few brief housekeeping points. First, we will be taking questions through the Q&A function only. So please post your questions there as the talk progresses. And then given the fact that we have a large number of attendees today, we will probably not be able to get through every question, but we will do our best to address as many as possible. And you will see that you can use the thumbs up option next to an existing question. And this is very helpful because it allows us to prioritize the questions that are of most interest to the largest number of participants. So the questions that get the most thumbs up are the most likely to get answered. So if there is a question you think you would like us to answer, please put thumbs up next to it. So now I am delighted to introduce our first speaker. Fiona Lindup, an MBE, is a highly experienced physiotherapist. She'll be speaking to us about exercise in MSA. And Fiona brings a wealth of expertise in supporting people with neurological conditions, including Parkinsonian disorders. And I am very grateful to her for joining us today. Please.
Thank you very much. I'll attempt to share my screen. Oh, it says sharing is not turned on. Maybe perhaps somebody else could share my slides. They've already been sent in. That might make it easier. If not, if I could be given permission to share my screen.
Just give me one moment, Fiona. Let me work out how to do that at this end.
Thank you. While we're dealing with that tech side, I'll maybe explain what I'm going to talk about this afternoon. I was asked to talk about exercise and the evidence for exercise in MSA. And so there is very little actual evidence for exercise in MSA specifically, but there is other evidence for exercise that I think we can borrow from. So that's what I'm going to be talking about shortly.
Fiona, you should have the opportunity to now share.
Let's see if this works. Can you see that? And if I do, let me just see if I can do it as a slideshow.
We can, Fiona, that's great.
Okay. And hopefully, let me know if it doesn't scroll through, but here we go. So I will talk a little bit about what the evidence is, the tiny bit that there is there, but I'm going to then share with you some of the other evidence for why exercise could make some difference in MSA. And then I'm going to give you some specific advice and suggestions of things that you can try. So as I say, there's not very much evidence around for MSA specifically, but there are a few case studies of individuals, and this quite recent one from 2024 was probably not something that we would be able to replicate in the UK, but this was a person in Canada who had 5 weeks of inpatient rehabilitation, and they had an hour of physiotherapy every day for a week, 5 days a week, and an hour of occupational therapy 5 days of 5 weeks, and 2 hours of speech therapy a week. And at the end of that very intensive course, their balance had improved enormously and their mobility had improved, so that when they went into hospital in the first place, they were in a wheelchair, but they were able to leave the hospital walking on a Zimmer frame just with somebody keeping an eye on them. So that was a major improvement, but it was very intensive, and it's probably not something that anybody's going to be able to access in the UK, even with private therapy. An older case study also showed that doing balance and flexibility exercises, it is about intensity. I think if we exercise but don't push ourselves a little bit, we're not going to make much difference. But these were exercises that were low to medium intensity. And then after a short beginning of the study that they did with this patient, they added in resistance training as well, particularly for their legs. And at the end of that, this person's balance had improved. At the beginning of their intervention, they hadn't been able to stand on one leg at all. But then at the end, they were able to stand on one leg for 10 seconds. And also other things improved as well. Their strength, their ability to reach, and their walking improved as well. So it's definitely looking encouraging. And somebody has recently, or a team have recently looked at whether a protocol could be developed. So a plan for people with MSA that therapists could follow, or people with MSA could themselves follow, where it was a 4-week intervention plan that would include strength, mobility, balance, coordination, and swallowing. Now, they haven't actually done it yet, but they've kind of put together from what evidence there is around the place and what we know about MSA to see that this would be a really positive protocol to use. And as I said, there isn't the evidence there for MSA at the moment. That I've shared with you much of what there is, but there is a lot of evidence for exercise and Parkinson's, which wasn't there 30 years ago. It's really developed over the last 30 years. But the reason we can borrow it from Parkinson's as well is because Parkinson's and MSA have the same protein involved. It's alpha-synuclein. And we know that in Parkinson's, exercise makes changes in the brain. We know it from other health conditions as well. And the more we repeat an exercise, the more pathways we make in the brain, and it makes changes in the brain at deep levels as well. So a lot of the evidence is showing that it's not particularly one type of exercise alone that can improve Parkinson's symptoms, but different types of exercise that improve all sorts of different symptoms, all of which are experienced in MSA. So balance can be improved, and the reduction of falls, which are a problem in both conditions. Walking can improve, and that sensation that a lot of people get, even with MSA, where your feet stick to the ground and you can't take the next step, that can improve with exercise, as can sleep and mood and memory and fatigue. And just as another thing to say about exercise and the brain is we know it increases dopamine levels, but it also improves serotonin levels and noradrenaline, which can improve your mood. And doing exercise sessions can also improve people's reaction times and things like that. So you can over-exercise, and there are some things that you shouldn't do around exercise, but generally exercise is going to be a really, really good thing to do. And in my own experience of working with people with MSA, it has definitely helped maintain people's strength in their legs particularly, and keep them walking and being able to get out of chairs and things more easily. Because MSA particularly causes problems with people's blood pressure dropping, as it can in Parkinson's as well, but much more so in MSA, there are some guidelines that I would share with you. And one is not to exercise first thing in the morning, because as you're getting out of bed, your blood pressure is still trying to adjust. So it's not the best time. And also you've got to get dressed and washed, which takes some effort. And then you may be more fatigued when you're trying to exercise soon after. Also, don't exercise soon after eating a meal, because that can drop your blood pressure as well. So try late morning, or maybe later on in the afternoon. Make sure that you drink enough, maintain your hydration. be very cautious about any exercise that's doing things above your head. You don't want to be doing lots of these kind of bicep curls would be fine because they're not going above your head, but you don't want to be doing exercises above your head with weights and things if your blood pressure falls, because that will make it fall even more. So that, and avoiding prolonged standing. So sit down to do some exercise. And the other thing that will help your blood pressure is doing some ankle bends and stretches. I'm doing it with my hands, obviously, because you can't see my feet. But do it in a chair. It can help pump your calf muscles, which pumps your blood further back up, helps your blood pressure. And you can do that before you exercise, but also before you stand up, which helps just get some more blood to your brain. And so my suggestions to you would be you can exercise little and often. There's evidence for what we call exercise snacking, 10 minutes here, 10 minutes there. Do different types of exercise, use things that do mobility, balance, strength, flexibility, and coordination, but be safe, whatever you're doing. Do not put yourself in a position where you could overbalance or fall, even out of a chair. Hydrotherapy can be helpful, but you do need to be aware that hydrotherapy pools are hot, and so is the air around them. So that can cause your blood pressure to drop as you're coming out of the pool. But if you can manage that and maintain hydration and things, that can be helpful. But exercise is a great thing as long as we enjoy it and as long as it's challenging and fun. If you don't enjoy it and it's boring, you're probably not going to do it. So find something that's good fun, if you can, to do. Do it with somebody else. Have a challenge. Have an app on your phone of some game that you can do that's a little bit active. And adjust things as necessary. I think I would say that one of the other tips would be put something like some weights or some tins of beans by the kettle. Sit down while the kettle's boiling and do some bicep curls, or do some, get a TheraBand, put it around your foot and do some resisted leg lifts and things like that, just so that you can be exercising while you're kind of not doing anything else terribly important while you're waiting for the kettle to boil. And so really, those are my main suggestions for you. I have put some references. I'm very happy for the slides to be shared with you, but I'm also happy to take questions through the Q&A.
Thanks a lot, Fiona. I think in the interest of time, we will now move to our second speaker and we'll take all the questions at the end. So we have a Q&A session together with Kinga. So we'll now move to Kinga, who is an experienced neurodietitian. She's a colleague of ours working at UCL. She will be speaking to us about nutrition in MSA, and nutrition is such an important aspect of living well with MSA. We're very much looking forward to hearing her insight. Thank you, Kinga.
Thank you for a lovely introduction, Veronica. And Fiona, I will put some cans of beans next to my kettle as well. I mean, it's a brilliant idea, actually. And because they are going to be ISO, I'll remember about them all the time. So hello, as Veronica said, I'm a dietitian with over a decade of experience in neuromedical conditions, working at Queen Square. And I'm here to talk about nutrition and research, but mostly nutrition. Would I be able to share my, oh yes, I am, I think. Okay. Can you see? Lovely. Thank you so much. So I've gathered some of the evidence-based dietary advice that we have for you. Now prepare now. So unfortunately, also as Fiona mentioned, we don't have that much evidence or research specifically linking into MSA. But we are looking at general advice that we would give to someone with neuromedical or neuromuscular condition. And because some of the symptoms are quite closely related to Parkinson's, we would also use recommendations and guidelines that are used for this group of people. So personally, as dietitians, as a group, we recommend early dietary support and dietitian referral if there are any problems with your nutrition. So the common issues might be dysphagia, so problems with swallowing, constipation, which is often seen with MSA, and hydration. And the last one, but I think the biggest one, is malnutrition, which I'm going to mention a little bit more later. Because with malnutrition, you're losing your strength, and that's something we absolutely do not want you to do. And ideally, nutritional care should be tailored to the person. Sorry, I think I'm skipping to yeah, this one. Yeah. So I'm not gonna be very revealing. It's an old, boring theme of balanced diet, balanced and healthy diet. But what we mean by that is a diet. You've probably heard about the Mediterranean diet, which is based on fish, on olive oil, on plenty of fruit and veg, on healthy fats, and loads of hydration. So in a way that you can adjust to yourselves is that aiming for small and frequent meals, because they might be able to help you with energy throughout the day and your gut function as well. But having smaller meals rather than huge meals is going to reduce risk of worsening orthostatic hypotension. Sorry, I think my tongue is tied a bit. So that's one of the main messages in terms of composing your meals, that they should be very colorful, but should be in small portions throughout the day. Texture modification for dysphagia. So if you start noticing that your swallowing is a little bit harder, that some consistencies are trickier to swallow. So usually it's the crumbly bits at the beginning. So a toast or a cookie that just might start coughing quite a lot on it. That suggests that there might be some problems with it swallowing. So we would advise to request speech and language therapist assessment, and they would advise you what textures and consistencies of food and drinks are best for you for the safest swallow. And another thing which is usually surprises people is adding salt to your diet, especially sometimes in the morning with your water, because that helps with, again, orthostatic hypotension. It helps with increasing the volume of blood in your vessels and just reduces the risk of falls and dizziness. So having some water with salt in the morning and then adding your salt throughout the day. So at the moment, the recommendations are for normal population up to 6 grams per day, but for MSA would be 6 to 10 grams per day, which is a little bit more. One of the issues patients often tell us about is constipation. So there are a few factors that come in play, but reduced mobility and autonomic dysfunction both affected a lot. So the best solution is to increase your dietary fiber. I'm not going to go into details on both fibers because we don't have that. We don't have time for going into the details, but fiber is mostly found in your fruit, in your vegetables, and whole grains. So in potatoes as well, especially in the skinny. So if you're having baked potatoes or jacket potatoes, have them with the skin, and whole grains, which is brown rice, brown pasta. But in ordinary pasta, and rice, there is going to be some fiber as well. So we want you to have a variety of different foods, and then the fiber itself, it won't work if you're not having enough water. So joined with that, the recommendation is to aim for 1.5 and 2 liters of water per day. because fiber needs fluid to keep things moving, because on its own it can make you actually a little bit more constipated. So always remember, if you're having plenty of fiber, add a glass of water to the meal. Unfortunately, not everyone will be supported with only that advice. And if you feel very uncomfortable, if that's an ongoing issue, please discuss with your doctor use of stool softeners or osmotic laxatives if that's something you need to take to help you. So omega fatty acids, those are very well known to in general to everyone in nutritious world, in terms of brain support, and so all the neuro system. So we know that omega-3 supports with reducing inflammation. Okay, it's not going to stop inflammation altogether, but it has the skill of helping your body to fight and reduce the inflammation. And it's really good for your brain health as well. So sources are oily fish, flaxseed, and walnuts, a few other things, but those are the mains. We don't have, again, evidence for MSA very specifically, but it has, in general, neuroprotective role. If you can't make yourself eat fish, you're vegan, vegetarian, please consider starting. Thank you. Please consider starting supplements. You can discuss it with the doctor or your pharmacist, which one would be the best. Vitamin D. So in a lot of neuromedical conditions or neuromuscular conditions, we see patients come with low vitamin D levels. And often I'm asked if they start taking vitamin D, is it going to improve hugely? Unfortunately, we don't have that confirmation of the relation. So I think that's one of the theories. It's because people with medical neuromuscular conditions, they are less on the outside and they're spending less time in the sun. That might be one of the reasons why at diagnosis they tend to have low or lower vitamin D levels. So I would recommend speak to your GP or your consultant to check vitamin D levels, and if they are too low, then you can start supplementing it. Again, in terms of the levels of supplementation or the product, it would be best to discuss with your doctor or pharmacist. I think the recommendations say that we shouldn't go above 4,000 international units per day, and that's the limit I wouldn't recommend anyone to exceed. And the main sources is, as I mentioned, sunlight. That's why people who spend less time outside have lower levels. There are some fortified foods and supplements, and unfortunately from food, we're not absorbing as much as to cover all our needs. So especially in the UK, we do tend to recommend supplements. The other vitamins that I get asked about are vitamin Bs, because they are very important for supporting nervous system. And again, as it's with any other supplement or vitamin, I would recommend you to ask your treating team to check your B12, B9 blood levels or plasma levels, because although it's a water-soluble vitamin, sorry, apologies, it still can accumulate sometimes in your body, and we would prefer you to have a stable level rather than having too much and too low. In terms of coenzyme Q10, we don't have much evidence, so I can't comment on this. Creatinine and antioxidants, it's a recent subject that keeps popping up because creatinine became very trendy, especially with exercising and with brain health. So it is still being investigated. We don't have any recommendations that based on evidence that those amounts are going to be safe or beneficial. We're still looking into it. However, antioxidants, I wouldn't recommend taking them in the form of a pill, because the best way we get them is from fruit and vegetables. So a rule of thumb is the more color there is in your fruit or vegetable, the better it is on antioxidants, the richer it is. And also different colors from fruit and vegetable, they symbolize different antioxidants. So basically having a rainbow on your plate, that's the best way to go, and to make sure you're providing yourself with plenty of good nutrition. And before taking any supplements, if possible, please discuss it with your doctors if they are not interacting with your medication, whether you're not taking too much. And always please ask your pharmacist and a doctor. So practical tips. Please monitor your health. As I've mentioned at the beginning, malnutrition or not getting enough nutrition and losing weight is quite risky for patients with or people living with MSA, because we know with any weight loss that's when you are less mobile and when it's especially unintended, you are going to lose muscle. As much as 50% of that weight that you're going to lose, it might be muscle. And muscle is actually very important for your movement. It's very important for your immune system. And really, it's better. And I know coming from a dietitian, it might surprise you, but it's better to be on a bigger side when you're having neurological problems, because we know some extra padding is protective and also from infections. So monitor your weight once a month, or if you notice that you are losing weight quickly, I would say once a week. And then if you're worried, please speak to your GP, to your MSA nurse, to your doctors. So ask for dietitian referral. Adapt your food consistency for easy and safe swallowing. If you start noticing, like I've mentioned before, swallowing issues, please ask to speak with speech and language therapist and then with dietitian. An occupational therapist can advise on assistive feeding tools for dexterity. And I wanted also to mention very briefly about long-term feeding, because that's another option and it's very individual. And I would just like everyone to have a think about it, discuss with your close ones, with friends and family, what are your thoughts? Because this is a very beneficial way of supporting you to stay in a better health for longer, preventing chest infections and preventing chest infections and choking episodes especially. And with the tube, because you can provide nutrition safely, that can reduce your risk of weight loss, of malnutrition, so you will be staying stronger for longer. One thing I want to mention, because I think sometimes there is a confusion, if someone has a long-term feeding tube, or PEG as we call them, it doesn't stop them from eating and drinking, okay? So tubes are also used for supplementing. They can be only used for water and medication, which might at some point is really important for you to stay hydrated and have access to your medication. So it's not only about the nutrition, but it's just helps with your comfort in later stages. So please, if you notice that your meals are lasting longer than half an hour, you're tired just thinking about eating another meal, please have a think about it. There is a fact sheet on the MSA Trust website that you can read about PEGs. Please ask to speak with your healthcare professionals. Dietitians can speak to you, can show you the tube, can explain everything. And advanced care planning, it's something I support. So please put your wishes in writing. You can say that in the future, you might like a tube only for water and medication or only for medication. Please say what you're thinking, what you believe in. If you don't want the tube ever and you don't want to discuss it, please document that. And every time we're speaking to you in a hospital, we also keep documenting that discussion with you. And if you say no, we will take it and we'll appreciate your decision. But just please talk to us about it and talk to your friends and family as well. And in terms of research, I hope I'm not too long. Like I've mentioned, it's really limited for MSA specific recommendations. So we need more research projects and we need more input from you because you know it best and you know what you need, and we want to work with you. At Queen Square, we've got a strong research team, and they are looking in variety of topics, in things about blood markers, and Bioreca is a huge part of that team, and they are doing huge work. I know there is a project going on feeding tubes, and they will want to hear your views before and after insertion in general about the tube. So please take part, because that's going to help us create more data and be able to advise you and other people living with MSA the best we can. From myself, I'm hoping to, I joined MSA team last year, and I'm hoping to do more projects on prevalence of malnutrition in MSA. I'm hoping to do some studies on how much nutrition you need on a daily basis, how it changes over progression of the diagnosis, how is it at the beginning of, or at the point of diagnosis, how weight and nutrition is affecting you long term. So we'll definitely be asking you for support, because without you we can't do that, and so it's a teamwork for all of us with you as the biggest group of information providers. So yeah, so that's summary. So diet plays a role in managing MSA symptoms, definitely. Please focus on hydration, healthy fats like your oily fish, and nutrient balance, which is that rainbow on your plate. Supplements like omega-3 or vitamin D might be beneficial. Ideally, you should have personalized advice from a multidisciplinary team, and more research is needed. Thank you very much.
Thanks a lot, Kinga, for the excellent and thoughtful presentation. I will now move to the Q&A session, and I have loads of questions myself. So whenever I see an opportunity, I will throw in some of my questions. But I'll start with questions from the chat. There is a question for Fiona. If you know any online groups that offer physical activity sessions bespoke for people with MSA, or anywhere we could get specialist support and things we could learn.
Thank you for that question. I think there are no actual MSA exercise groups that I am aware of, but even if there were, there might not be in your area. But the Parkinson's UK has exercise things going on all over the country, and there's quite a close association with local branches supporting people with MSA. So I would suggest having a look on the Parkinson's UK website to see if there's any exercise groups in your area, and specifically if they're run by a physiotherapist or another health professional who understands MSA. That should really help for them to be able to appropriately guide you on which bit of the exercises you need to adapt. There may be other things that you could do. There's a couple of agencies that are doing online exercise, individual exercise sort of things with people with neurological conditions, and they are doing some for people with PSP, which is another atypical Parkinson's condition, and also with Parkinson's. So you could maybe have a look at some of their websites and see if you can get a bespoke thing. I know that the PSP Association of Parkinson's UK have managed to agree some free sessions. I'm not sure that MSA Trust have managed that yet, but it might be something for the future.
Okay, and this following on from that question is actually a question I had, Fiona. Do you think that supervised and specialist neurophysiotherapy is essential for MSA, where a well-guided, home-based exercise program that has been thought specifically for MSA can be just as effective? Just thinking of the future and what we can, where can we intervene more effectively?
I think in an ideal world, it needs to be a specialist neurological physiotherapist who understands MSA. But that doesn't mean that having set a program that can't be delivered by somebody else who's trained to do that. I think we're still going to need those people who fully understand a condition. And as you'll all be aware, MSA is an unusual condition that many health professionals haven't heard of, especially generic therapists. And so I think it is important that they understand the challenges of the blood pressure and things like that. So yes, but I think any physiotherapy, I'm going to talk about physiotherapy specifically, anything is better than nothing, as long as it's not asking you to do something like exercise straight after you've had your breakfast or something. So it does need to be understood, but any activity is really good as long as you don't overdo it.
Okay, thank you. I will now alternate. I'll move to questions for there's a question for Kinga. Could you share any advice about the keto diet? How long you'd need to try this before you see a benefit or not? And any support there is to do it is felt appropriate for an individual.
Thank you. Yes, that's a hot topic, especially from internet influencers. Unfortunately, we would not recommend keto diet per se because it carries quite a lot of risks with itself. Surprisingly, even with increasing a chance of type 2 diabetes with some individuals. So it's an exclusion diet that doesn't provide you with all the micronutrients, and it's very drastic diet, and also it creates a strain for your heart, and with if you are having plenty of saturated fat, it's very controversial diet, and I would personally not recommend it. We don't have any evidence apart from epilepsy that it's helpful and it's beneficial. If someone wanted to try, I would say more like a low carb diet or low GI low glycemic index diet, which would so just swapping all your carbs for brown sauces and having just a small amounts, which might be actually beneficial with orthostatic hypotension as well. But pure keto diet, I wouldn't recommend because of the risks it carries with it. If you would like to try it, then if that's your wish, please find a dietitian that's going to support you with doing it in the safest way. And also, I mean, some people, in terms of how long would you need to try it, the time it gets for your body to go into full ketosis, that can take as much as a week if you are not getting any carbohydrates from any sources of your diet. So to produce those ketone bodies, it takes a little bit of time. So I would say, a couple of weeks at least, maybe a month. Although, please, if you're thinking about it, make sure it's the keto diet, not the low carb versions from the internet, high saturated fat versions as well. And also remember that feeling of euphoria with ketogenic diet that people talk about, that they've got the power and they've got the energy, clear brain and everything. That's because your ketone bodies are feeding your brain instead of glucose. So your body is in emergency mode. So it's sort of like before someone so it's an emergency mode that usually your body goes into before someone pass away. And I don't know if you remember, as a child, I was, being told stories about people on the desert that would see Fata Morgana, the imaginary beautiful island and everything. So that's part of ketosis. So people the brain gets into the exciting mode just to make you feel better, although your body is struggling. Okay, so no. Thanks. Sorry.
Thank you, Kinga. Following on that kind of, would you have any advice for MSA patients who are impacted by protein-related food, which impact on any medication, levodopa, for example? So I think the question is any such interactions with medications.
Yes, so that's something we know about. From research, we know it happens to around 5% of people who take levodopa. So it's not for everyone. But if you notice that's the case with you, please consider spreading your protein into small portions throughout the day. So the bigger portion of protein you're having at one time, the more of an effect will have, because it just fights for the same receptors in your stomach, so or your bowels. So there are different ways you can spread the protein throughout the day, or some people choose to have the biggest protein meal at the end of the day. So when they sleep, it doesn't, the issues with movement, dyskinesias are not affecting them that much. Then it happens during the night rather than during the day. But please don't remove protein totally from your diet. If you're really struggling, please ask to see a dietitian.
Thanks, King. And I think there is just a last small question. What is your opinion on magnesium to assist in muscle strength, enhancing sleep, reducing fatigue?
Again, if you're deficient, that's going to help you tremendously. Some people find it helpful. There are different types of magnesium. So different ones might help you with reducing fatigue or headaches, and different one with sleep. So, and different ones with constipation, actually. Magnesium, some forms of magnesium are going to help you with your constipation. So yes, it's worth trying. Please do not get crazy amounts. Try to take reasonable. At the top of my head, I can't tell you what would be the most safe dose, but please discuss it maybe with your pharmacist. It can help some people with sleep. It can help with reducing fatigue, with constipation. So I think it's worth trying, definitely, if someone feels that would be good. Thank you.
Thank you. I have a question myself, and then we got to there. I think there is a new question appearing in the chat. My question for Fiona, actually. So we know that in Parkinson's disease there is this increasing discussion about potential disease-modifying effects of exercise. Do you think it's realistic to consider this possibility in MSA, or should we remain cautious, let's say?
Well, I think we still have to remain cautious even in Parkinson's, but the evidence is pointing in that direction. So I think the problem is that in the MSA research is quite a long way behind the Parkinson's research, hasn't had as many people going into research studies and things. So I think we can't say for sure. And I personally have thought over the years that I've treated people with MSA that I've seen exercise help level out their condition where they were for a while. So I don't think we can reverse it. And as yet, I don't think we can reverse Parkinson's either with exercise. But I do think we might be able to prolong a period of really good strength and quality of life and mobility. And the problem is we haven't researched that enough to know, but I have seen it in my patients.
Yeah, and the next question in the chat, Fiona, is somebody is asking from patient's view that my husband's view in regards to exercise that it won't do any good, given the consultant told him he has probably 7 years prognosis. So some people don't see the point of exercising.
I think all exercise can actually make a difference. I think it can make a difference to mood, and I can fully understand that sense of what's the point. I've been given this very difficult diagnosis and not offered any hope. But I think because we know that exercise can actually enhance your mood, and it can help with apathy, and it can help with motivation and sleep, as well as your mobility, I think that actually it could make a difference to your day-to-day life. And I think you just have to find something that feeds you a bit, or something where at least you feel that if I do this exercise, I could reward myself after doing it. If you're really not an exercise person, give yourself some cake afterwards, as long as that's okay on the diet side, or some other reward, but something that just says, I'm going to do this, even if it's only for 10 or 15 minutes, because it could make a difference. Not doing it, of course, won't help at all. So what have you got to lose there?
Yeah, I fully support that that approach. And let's say for somebody who has just been diagnosed with MSA and is unsure where to begin, what would be your top three practical recommendation to start an exercise routine?
Okay, so I would say if your balance is okay, and you ideally go and see a physiotherapist and get a program. But one thing you could do is practice sit to stand from your chair several times. You could, if it doesn't make you dizzy or drop your blood pressure without you being dizzy, you could see how many sit to stands you can do in off a dining room chair, something like that, that you could do in 30 seconds or a minute. So I would say sit to stand because that helps your quadriceps muscles stay strong. You could do some balance exercises, holding on to the back of a chair or a kitchen work surface, doing some standing on one leg and the other leg doing some exercises. So you're practicing the balance on one leg with a bit of hand hold, but also exercising the other leg. And then I would suggest also doing some weights for your arms, but not above your head. Or getting a TheraBand and doing some expansion exercises with that. Ideally, ask to see a physiotherapist as quickly as possible to get a program.
Yeah. And how often should someone with MSA aim to exercise, and how do we judge the level of intensity is appropriate without overdoing it?
Well, I think again we have to borrow that from Parkinson's, and the exercise recommendations in Parkinson's are basically 5 days a week, 30 minutes a day, minimum, with sort of vigorous. I think vigorous is going to be difficult with MSA, but I'd say moderate exercise, something that challenges you a bit. If you can get yourself a little bit out of breath doing something, that's great. A good way to do that is to give yourself some exercises, even in a chair, but to do them to a piece of music, a song, and don't stop till the song's finished, as long as you don't feel dizzy. Because actually that can make you do it at a certain speed. But I think anything like that, and get somebody else to do it with you, make somebody else do it with you, and so you can do it better.
Yeah. So we have a question in the chat. Says a physio friend offered sitting pedals. Will this be helpful?
Yes, especially if they have an adjustment on them where you can make them a little bit harder to pedal so that you have some resistance. They will help sort of a bit of range of movement and mobility if they don't have that. But if they if they've got some resistance, they're more use. And you can use them for your hands as well. You can put the pedals on a table against a wall and do some pedaling with your arms too.
And I think this is more of a medical and maybe harder to answer. I'm mobile and exercise, but when I'm my off time from meds, I lose all my strength in my legs. Is this normal? I think we won't try to answer medical questions without actually knowing the whole picture, but I think it's not uncommon for people to feel weaker
Yeah.
during the off period.
Yes. Not the best time to exercise.
Yeah. And another question, is there any way we can all do to raise the profile about MSA, PSP, apart from, say, for example, high profile celebrity raising the profile of these conditions for us? Yes, that's an important question. And we did see some even rarer conditions than MSA having a much higher profile because of celebrities. But I think all we can do is to do our best to engage with research, to engage with maybe to join forces with other condition or other support groups that are related. For example, some programs that are designed for Parkinson's disease could be relevant to MSA where we can join. That would definitely help us participate in those research as well. But happy to hear from Fiona and Kinga your views about that. Raising the profile about MSA.
Yeah, I think
People know about it.
It's difficult, and I think PSP got a bit of mention at the weekend because of Jesse Jackson, who died of PSP, but most of the news channels didn't really pick it up because they didn't know what it was, I think. And I think MSA has the same problem, and I think we just have to keep sharing the news about it as a condition, and particularly the need for research.
Yeah.
There is one other question in the chat, actually, also for you, Fiona, while we have you. And that is somebody's asking whether you think that Pilates will help.
Yes, I think Pilates is very good, particularly if you're at an early stage of MSA. I think that could help a lot, but you would have to just be cautious about that prolonged standing if you have a blood pressure problem. But you can do Pilates, floor Pilates, you can do it on all fours. Anything like that increases your core strength would be really helpful.
Thank you. We have a few minutes left, so I would encourage you to put more questions in the chat. In the meantime, I have a question for Kinga. Unintentional weight loss. I see this very common situation with people with MSA. What are the early warning signs that somebody is not meeting their nutritional needs, and when should the dietitian become involved in that?
So if people start noticing that they are eating smaller portions, that they are not having their snacks, and then clothes become too loose, maybe rings as well, like wedding ring becomes too loose, sometimes the dentures. So if I would encourage everyone to weigh themselves every now and then, but I know not everyone might have scales at home, but yes, if you notice that your arms or legs become thinner and you feel that there is some muscle mass loss, that you notice that there is less muscle, definitely speak to your doctors. The quicker we can pick that up, the better, because as we've mentioned, losing muscle, losing weight is not that beneficial with MSA group of patients, like it is with Parkinson's, like it is with MND. That was quite, I think that they have quite good oh, sorry, I've lost my word. There is a lot of information and people are talking about them. I wish MSA was the same. So yeah, it's just noticing, and sometimes we don't notice that we're losing weight, but our family, friends, they can. So if they tell us that they think our face becomes a little bit more sunken and the cheeks and anything, please listen to them and ask for your help, because it really maintaining good nutrition is helping with your quality of life, and it just helps you stay stronger for longer. So it's really important that you keep it. And I just wanted to say, like, a final message from myself, because I've been talking about the antioxidants, perfect diet, fatty omega-3 and everything. At the end of the day, I also wish that you all keep enjoying food. So if there is any family gatherings, meetings, please go as often as you can. Socialize with your loved ones. Please eat whatever you fancy. Just if you can keep your diet 80% of the time on a good path, then just allow yourself still some pleasure, because food is so important socially, emotionally, and yeah, it brings people together. So please still enjoy it. So if you want that ice cream, and just don't just have it, just enjoy it as well.
Okay, so I think we'll take the last question. Somebody mentions here that I have it's a nutrition related question. I'm wondering if beetroot is beneficial. It can improve blood flow and can also be good for constipation, but I'm wondering if it is okay for MSA patients to consume. Also, if so, is beetroot juice acceptable form if chewing is difficult?
So, I mean, beetroot is very good in general as a part of your balanced diet. Whether it's a juice or grated beetroot, it's really nice with a bit of sugar and lemon maybe, and salt. But the only thing from research that I can remember definitely is that beetroots and beetroot juice helps with lowering blood pressure. So I wouldn't go crazy on that, and I think it's you might need to monitor whether how much you're having and whether it's affecting your blood pressure, because there is an evidence that it can reduce your blood pressure, and that's some of us might not want that to may not want to have that effect on themselves.
Thanks a lot, Kinga, and thanks a lot, Fiona. Before we close, we would be really grateful if everyone who attended the meeting, if you would take a few minutes to complete a feedback survey that will be shared afterwards. The feedback is really important for us. It helps us to decide on the future sessions and to choose which topics we focus on, and we want those to be the topics that matter the most to you. Thank you again for joining us today. We hope you found the session helpful, and we're very much looking forward to welcome you to the next webinars. Have a good afternoon, everyone. Thank you.
Thank you.